due to poor connection. Oh, there we go. Looks like we're live. 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 Hi, everybody in the world. We're live on Facebook from a hospital. Hi, Mary Lou.
Our plans changed today, didn't they?
Yeah, they did. We had a really exciting, adventurous, spiritual, friends and fun day all planned out that was going to take us from morning till late at night. But plans changed. And I'm in a hospital bed. Some of you have probably seen the update that Mary posted earlier. And so here's a little update from my mouth to yours, so I can just give you a little quick what's going on and, fill you in. So, anyways. Hi, Mary.
Get right to the biscuits and gravy.
Okay. Thanks. The biscuits and the gravy. Okay. Anyways, yes. So, we're at UCLA Ronald Reagan, and this is the same hospital where I had my surgery. And I love that you're touching my hair right now, but I can't concentrate. I'm just zoning out. You're touching my hair. So if you want me to get to the biscuits and the gravy, you just let me talk. I'm tired. I'm spacing out. Okay. So I was here 3.5 weeks ago with chest pain and difficulty breathing, and after every test under the sun, it was determined I had a little bit of fluid around my heart, and they gave me some anti-inflammatories, sent me home. Every day it got just a little better, and so we thought that everything was kind of going to be fine, and that the fluid kind of went away and the inflammation went down. However, before however, but we followed up with my doctor, who also referred me to a cardiologist. So I have a really awesome cardiologist on the team right now, and so that way we have someone specifically looking over at the old ticker. And the cardiologist checked me out this last Wednesday, put me on another medication for a couple weeks, and decided that he wanted to ring up another echocardiogram to just make sure and see how things compare to when I had the echo done about 3 weeks ago. Just in case you guys don't know what an echocardiogram is, it's pretty much the same thing as a ultrasound, but done all around the heart to see what's going on with the heart and its functionality, etc. So this morning we went just like a normal day, had the echo done. The technician was a little concerned, it seemed like. She asked me to wait in the lobby. She actually emergency paged my cardiologist to have him review it. Then the cardiologist called me and said, hey, there seems to be more fluid than last time. I'm going to look this over, and I'll get back to you later. But for right now, I want you to come back on Monday and see me, and just stay well hydrated today and take it easy. We left there and we went to our next location, which was a great afternoon Hanukkah party with our HMI fam, and we were having a really nice time, and I actually felt fine. I wasn't having the symptoms that I did back when I had that experience that brought me to the ER 3.5 weeks ago. And so I didn't think anything was wrong, but I got a call, actually 3 calls from the cardiologist, and he had spoke with my cardiothoracic surgeon, and the two of them together looked over my results and determined that this was not something to wait on or play around with, and they asked me to basically wrap up and head to the ER back here at Ronald Reagan UCLA on the campus. So we said our goodbyes, we grabbed our stuff, we packed a bag, we came over and we went right to the ER, and we were admitted straight away. And they did another echocardiogram, another EKG, and then they said that it looks like I've got about a liter of fluid surrounding my heart within my heart sac, which is partially made of Gore-Tex. If you remember from my surgery, they had to take a piece of that off and repair it with Gore-Tex. And so this heart sac is now filled with a full liter of water, and it's putting pressure on my heart. And even though I didn't feel any pain, something started happening where basically the start in the right aorta was actually starting to collapse, and the word is what's it called, Mary Lou? Tamponade. They kept saying tamponade. I thought they were bringing out olive tamponade and crackers, but it's what's it called?
Oh, hold on 1 second.
Tampon.
I put it in your.
Oh, it's in one of the
first.
scriptures. Anyway, it's like tamponade. Whatever it means is it's when the pressure of your heart starts to, the pressure of the liquid starts to actually collapse the heart, and if that happens, and it continues to happen, the heart basically will go, and that's lights out. So we don't want that to happen, obviously. And the team came in, and suddenly there was like 6 doctors and whatnot in the room with me, and all talking and going through stuff, and they decided that we needed to go ahead and drain the fluid immediately. So just like that, we were already doing blood tests and starting IV and doing some surgery prep, and they determined that it was time to, oh look, there's a whole description of what cardiac tamponade is. We'll tell you in a second.
It's backwards.
It's backwards. You're not going to be able to read it. But you can look it up yourself, and now you know what it's called. Anyway, that's not the point. The point is that they wanted to get me off and start this right away. Now, we had come from a nice lunch party, so I had food, and therefore they couldn't do full sedation or anything like that because of not having fasted. And so they had to kind of take it easy and give me just little bits of light sedation, and then they numbed me up. They brought me into the surgical room. I had a whole team of great doctors and staff that actually weren't even working today. They had to page them in. They were on call. They had to come in. The cardio team had to come in and to do this procedure. And so I had to stay awake the entire time. I had barely any sedation. They had to give me lots of shots to numb the area, which hurt like hell. And then once that was done, they inserted a needle type thing from below, and they put it into the heart wall, into the sac, and then they started to actually pull and drain the fluid out. Being that there was about a liter, they drained about half of it. And I saw it in this big glass bottle of gnarly looking fluid, bloody, watery looking stuff. And they finally, yeah, we'll get to that in a second. I have to give them a warning. That particular bottle is being sent off for tests now, all kinds of tests. We hope that comes back quite normal. We don't know why this happened yet, but because they were able to drain part of it, they have to continue draining it. So what they did was they left the drain inside of me, and it hurts. I can feel it because it's like a catheter through the heart, and it's actively still draining the fluid, and it's going to do that for at least the next like 24 hours. Now I'm going to show this really fast. So here's a quick warning if you are squeamish. It's not that bad, but if you are of the squeamish type or don't like the sight of blood, I'm going to give you a chance right now to look away. Okay, so here's what it looks like. See, it's not that bad. Whoa, blood. It's like bloody and watery, and it's hooked to this tube, and this tube is up through this thing, and anyway, that's it. It's just draining, and this will keep doing that to get the rest of the liquid out, and that's really all we know right now. We're not going to have the test results from the heart fluid for a couple days, most of the tests. Most likely I should be able to go home tomorrow night. They'll keep me here most of the day probably, and they got to drain this bag every 6 hours, and then they'll have the doctors come and check it out again. We'll probably do another echocardiogram tomorrow. If they determine that everything has drained, they're going to pull the catheter thing out, which from what I understand is not another surgical procedure. They can do it bedside. I'm sure it's not going to feel great. It'll probably feel like when they pulled the tubes out that were draining me after the last surgery, but it is quite kind of uncomfortable, so I won't be mad when it's done. And if all goes well, we will be done tomorrow and be home by the evening. That's kind of it. It's a busy weekend. We have 4 events today, we couldn't make it to 2. We have 2 events tomorrow that I don't know if we can make it to. Probably not, but I would like to. Big audition on Monday. Gotta make that somehow. But as it goes, man, you can't control what you can't control. You can only control how you react. So we're gonna stay positive and stay smiling. And I got my baby Mary Lou here with me, my bestie, my caretaker, my wife, my love, and she's here taking good care of me. This is a pretty decent room here. We're in an ICU, but it's a little better than typical ICU. We actually have a bathroom in the room and a couch, and so she can get comfortable and chill. And we got some leftovers from the lunch party, so we're gonna have some food and relax and get some sleep. And
Hanukkah.
I said that already.
Latkes.
We have vegan latkes. Vegan latkes. What's in a vegan latke? What's not in a vegan latke is butter and eggs, that's for sure. Okay, so anyway, we're just rambling now. So this is my room for the night, back in the hospital, not where I wanted to be. I've spent my fair share of days in hospitals this year, but all in all, hopefully this is just a little, a little bump in the road. It happens. My surgery was so intense that things like this, are possible. With all the stuff that happened, all the trauma that we went through here. But hopefully we'll get to the bottom of what really may have caused it, and at that point learn hopefully to not have it happen again, or just know exactly what it is, so we don't have to end up in another emergency heart procedure like we did today. So, what, Mary Lou?
No, we just announced our film today.
I know. We just did this great Facebook Live video last night and announced our new documentary movies, and we were just getting excited to really get things grooving. And but we're not going to let this stop us or deter us or get us down even. It's just our weekend plans have just changed a little. Team here at UCLA is amazing as always. I saw that Mary had my phone when I was in the surgery, and she posted. It looked like a lot of people had reacted and commented, and so thank you everybody. I haven't had a chance to even look at that yet, but I will look at everybody's words, and I know you've been praying and chanting, and all the love that you guys have been giving me since day one has been just absolutely unbelievable, and thank you so much for that. That's pretty much all I got, guys. Just gonna have some food now. We're gonna relax, get a little sleep, and we'll update again tomorrow when we know what's going down. So I hope you guys are all having a great night, and a great weekend. And
hey, you have hair.
I have your hair. Well, I have hair again. But anything else, Mary? Did I leave anything else out?
I don't think so.
Okay.
I'm exhausted.
She's exhausted.
That was scary.
It was?
Yes. Because I love you. You're my BFF. My everything.
Oh. Thank you, babe. I love you.
I love you.
All right, kiddies. Enjoy your Saturday night. We're going to rock it out here in the hospital. Don't be jelly.
We're watching My Cat from Hell.
So random.
The Cat Daddy.
So, guys, good night. And we'll update you tomorrow when we know something. But thanks again. Love you all. And we'll talk to you again soon.
I can't get in here.
Are you stuck? I'll close the video.
No, don't use that.
Oh.
Because that hurts. Okay. Bye, guys.
Bye. Good night.
Thank you.